Hello, my name is Dr. Jolene Rudell, and I'm an assistant professor at the Shiley Eye Institute, located at the University of California, San Diego. I am a pediatric ophthalmologist, and I'm also a physician scientist. That means I spend time in clinic treating children with eye disease, but I also do basic science research on the diseases that affect my patients. My career goal is to help preserve children's vision that really lasts for the rest of their lives. One of the most common eye diseases that I see in my clinic is strabismus or eye misalignment. Often patients present to me typically with eye crossing or eye wandering, and they can have other types of strabismus as well. Strabismus is a very common eye disorder which affects about 2 to 6% of the worldwide population, mostly in children. In addition, strabismus is a very serious eye disorder. Strabismus is associated with amblyopia, which is the leading cause of irreversible vision loss in children that lasts for the rest of their lives. In addition, patients with strabismus and amblyopia have known functional difficulties as well, as they can have difficulties with everyday activities such as reading and driving, and especially later in life are considered a fall risk. Even though this is a very common and serious eye disorder, there's not a lot that we know about what causes strabismus in many of my patients. Also, treatments for strabismus, largely through surgery, can have variable success rates, as long-term studies have shown that approximately half of these surgeries can fail over time. This is why my research really focuses on strabismus. I am studying the role of the extraocular muscles, or the muscles that surround the eye and directs eye movements, and I'm studying the role of these muscles in strabismus, which has not been well studied. I found that although patients can have the same type of strabismus, their extraocular muscles can look very different from one another. For instance, I found that patients with Apert syndrome, which is a genetic syndrome, can have very abnormal extraocular muscles compared to other patients with strabismus without a genetic syndrome, even though clinically they look the same and we also treat them the same. We found that in patients with strabismus with Apert syndrome, their extraocular muscles were significantly smaller and also had higher numbers of synapses, which are connections from the brain to the muscle. This is a figure of a synapse in the extraocular muscle. Labeled in red is a connection from the brain, where it contacts the muscle in the area labeled in green, which is a receiving end of those signals coming from the brain. Overall, this tells us that although patients present with strabismus, the underlying causes of strabismus may be very different in each patient. And likely there are more causes of strabismus than we realize. Knowing more about what causes strabismus in patients will only help us treat strabismus more effectively. I'm also examining new drugs that show significant promise as an effective therapy for strabismus, and I'm studying why these drugs work. With my clinical and my research, I really hope to be able to tell my patients why they develop strabismus and also to offer better treatments for my patients. I am hoping to find better treatments for my patients to improve their quality of life, which can last for a lifetime.